Let me begin 2021 Health and Medical Cooperation Platform on the Korean Peninsula inaugural meeting. I am Lee Young-ah, the announcer of Ministry of Unification. It's great to be here. Today's inaugural meeting is held under the theme of Sustainable Health and Medical Cooperation Platform on the Korean Peninsula that we all make together, joined by the ROK government, municipal governments, international organizations, civic groups at home and abroad, academic community, and foreign embassies in Korea. Health and Medical Cooperation Platform on the Korean Peninsula seeks an open platform where any agenda can be discussed and coordinated on an ongoing basis. As such, today's sitting is arranged as a roundtable to give equal opportunity to speak up for everyone. Today's event is joined by participants in person and also virtually from Zoom. It is also live streamed from Ministry of Unification's YouTube channel. And also, from the offline and online, we are having the simultaneous interpretation provided. Before we officially begin the program, let me introduce our special guest of today. When I introduce their name, please give them a big round of applause. First and foremost, we have Minister Lee In-young of Unification, who organized today's event. Minister Kwon Cheol of Health and Welfare couldn't join us today to attend National Assembly session, so on his behalf, Second Vice Minister Yoo Gun-hyuk is here with us. Chairman Lee Kwang-jae of Foreign Affairs and Unification Committee of National Assembly is here with us. President Song Ha-jin of Governors Association of Korea is here with us. President Shin Hee-young of Korean Red Cross is here with us. Chairman Lee Gi-bum of Korea NGO Council for Cooperation with North Korea is here with us. Professor Chun Woo-taek of Yonsei University is here with us. President Kim Young-hoon of Korea University Medical Center is here with us. Director General Jerome Kim of International Vaccine Institute is here with us. Executive Director Lee Jun-mo of Concern Worldwide Korea is here with us. And on behalf of the panelists today, Professor Kim Shin-gon of Korea University is here with us to moderate session 1. Chairman Kang Young-sik of South North Korea Exchange and Cooperation Support Association is here with us to moderate session 2. Once again, I'd like to thank all the participants for being here today for 2021 Health and Medical Cooperation Platform on the Korean Peninsula out of their busy schedule. That was for the introduction of our special guest today. To open up today's event, Minister Lee In-young of Unification will deliver opening remarks. Please welcome him with a big round of applause.
Hello, everyone. I am Lee In-young, the Minister of Unification. Today, I stand here with a very delighted heart to launch the Health and Medical Cooperation Platform on the Korean Peninsula. We are here to set our journey off on making a new and very meaningful cooperation platform. And thank you very much for taking your time. I would like to first thank the Second Vice Minister Liu and all the distinguished guests and the support that you showed. And I would like to thank Chairman Lee Kwang-jae of the Unification Committee of the National Assembly. I would like to thank him for being here on behalf of the National Assembly. I would also like to thank the Secretary General of WHO and the Director of Gavi, who sent their special messages to congratulate our inaugural meeting. I would like to thank them once again. I would also like to thank President Shin Hee-young and Professor Chun Won-taek and Professor Kim Shin-gon and President Chun Won-taek, who are contributing greatly to this meaningful event. Moreover, I would like to thank KDCA as well as the local governments, including Gangwon-do Province and the foreign missions in Korea who are here today. It is difficult for me to enumerate everyone who had contributed to this platform, but I would like to take this opportunity to thank them very much. Distinguished guests, the COVID-19 pandemic and the climate change is changing our livelihoods, and also we are faced with challenges that we haven't seen before and then cannot be solved with political resolutions. And we are faced with a common threat, and we should address this threat together. This Health and Medical Cooperation Platform on the Korean Peninsula is a step forward to becoming a Korean Peninsula, a prosperous one and a healthy one. To design a platform for the people on the Korean Peninsula and for their happiness and health, this is the way forward that we have envisioned. And this is a platform where everyone can come in, and it is an open platform for the stakeholders to contribute and have a discussion. And this will be a collective intelligence platform where everyone can come together for a better future of the Korean Peninsula. Whoever is interested can come together. In the academia, experts and specialists, they're all welcome on this open platform. I believe that the humanitarian aid to North Korea is something that should go beyond any political divide or interests. And if it happens, if it resumes, that has been stalled for a long time, this will be a very meaningful platform to uphold this noble sacrifice and noble initiative to a humanitarian aid. And it is also the international community's consensus that humanitarian aid is needed in the North Korea, and it is also, we are also preparing for a humanitarian aid to North Korea. Last week, I was in the Vatican City aiding President Moon, and I had an opportunity to speak with the leaders there, and we had talked about a possibility of cooperation in terms of humanitarian aid to North Korea. North Korea is also, I believe, have their own interests or their own reasons why they cannot respond directly to our hand of help on the humanitarian side. We are at a very meaningful juncture to come up with a meaningful resolution, and this will be a step forward, the first step that we take forward to a prosperous and peaceful Korean Peninsula. Distinguished guests, the Health and Medical Cooperation Platform on the Korean Peninsula takes its first step today. I would like to ask everyone who are interested to take part in this platform. All the needs and demands in terms of health and medical cooperation will be here, and we will muster our strength together in order to solve these issues. And this will also bring the dynamics, and we will be able to demonstrate the dynamics in terms of medical cooperation platform here on the Korean Peninsula. And I believe that this is a great platform where everyone can come together to bring your intelligence. Thank you very much.
Thank you, Minister Lee, for your opening remarks. Once again, please give him another big round of applause. Next, on behalf of Minister of Health and Welfare, Vice Minister Ryu Gun-hyuk, and President Song Ha-jin of Governors Association of Korea will make welcoming remarks. First, let me invite Vice Minister Ryu Gun-hyuk of Health and Welfare to the stage. Good afternoon. I am Second Vice Minister Ryu Gun-hyuk of Health and Welfare. It's a great honor and pleasure for me to be here. Minister Kwon was scheduled to attend, but I'm here on his behalf as he needed to attend National Assembly meeting. Please understand. Let me congratulate on the launch of Health and Medical Cooperation Platform on the Korean Peninsula. I also would like to thank government ministries, international organizations for their missions in Korea, and municipal governments and private organizations and academia and experts. My special goes to the Ministry of Unification and officials for putting this event together. The Health and Medical Cooperation Platform on the Korean Peninsula is an open, integrated platform to discuss and coordinate all agenda on the Korean health and medical cooperation on an ongoing basis. As inter-Korean communication channel is reopened with heightened expectation for resuming inter-Korean dialogue, we are witnessing growing interest in inter-Korean cooperation projects. Of all, health and medical field is mentioned as a priority area for cooperation. Indeed, inter-Korean dialogues for health and medical cooperation have been steadily pursued. First and foremost, the Pyongyang Joint Declaration at the Inter-Korean Summit on September 19th, 2018, two Koreas have agreed to enhance cooperation in quarantine health and medical. To implement the agreements, Vice Minister of Health and Welfare, Kwon, the current minister, attended as chief delegate at the Inter-Korean Health and Medical Sector Dialogue on November 7, 2018. At the meeting, we agreed to develop plans for information sharing and response programs to prevent entry and spread of infectious disease and enhance cooperation for dialogue and diagnose, prevent, and treat infections. I remember many nations had high hope for such an endeavor. Furthermore, we proposed the Northeast Asia Quarantine and Health Cooperation Organization to move beyond the Korean Peninsula to seek regional health and medical cooperation. But North Korea has yet joined it, and inter-Korean dialogue has met with a difficulty. In particular, the COVID-19 outbreak last year has forced the entire international community as well as Korean Peninsula to face a crisis in every aspect of politics, economy, society, and health. We are living in a globalized world without any borders. In the global era, traditional security backed up with the national defense is important, but with growing importance of health and medical cooperation for infectious disease and climate change responses, health security and human security are becoming increasingly important. Above all, the pandemic this time clearly showed that it is really essential to acquire multifaceted and multidimensional responses to emerging pandemics. Stronger capability is really important, and the Korean Peninsula is not an exception. As such, inter-Korean health and medical cooperation should be a common goal and universal value that we must pursue absolutely in a continued and organized and ongoing manner for the sake of health and happiness for people on the Korean Peninsula. This meeting means a lot in that it marks the starting point. I hope that at the Health and Medical Cooperation Platform on the Korean Peninsula, meaningful discussion can be made on inter-Korean health and medical cooperation with practical plans developed so that it can contribute to ensuring life safety, peace, and reconciliation on the Korean Peninsula. Once again, I'd like to thank all the participants for joining us today. Thank you very much. Thank you very much, Vice Minister Ryu Gun-hyuk, for your welcoming remarks. Now, thank you very much once again. Please give him a big round of applause. Now, let me invite President Song Ha-jin of Governors Association of Korea for another welcoming remarks. Please welcome him with a big round of applause.
Hello, everyone. Good afternoon. I am President of the Governors Association of Korea, Song Ha-jin. It's truly meaningful that we're gathered here to discuss the Korean Peninsula Health and Medical Cooperation Platform, taking its first step amidst a global health crisis. I would like to thank Minister Lee In-young of Unification for hosting this event. and also Minister of Health and Welfare, Second Vice Minister Yoo Gun-hyuk, for his participation. I would also like to extend my gratitude to Chairman Lee Kwang-jae of the Foreign Affairs and Unification Committee of the National Assembly. I would also like to extend my gratitude to Director General Tedros Adhanom Ghebreyesus of the WHO and Jose Manuel Durao Barroso, Chairman of the Vaccine Alliance, for taking time to grace this event. I would also like to welcome and thank the moderators of the breakout sessions. With the recent outbreak of COVID-19 and climate change, cooperation in the field of healthcare and prevention of epidemic on the Korean Peninsula has become necessary to prevent the spread of infectious diseases. Cooperation in this field of healthcare is the basis in protecting the lives of the people on this peninsula to achieve peace, and it's a task unachievable with a unilateral effort. The Korean Peninsula Health and Medical Cooperation Platform, which the Ministry of Unification is taking the lead, is an open community where experts, academic groups, companies, and NGOs can participate as well as governments and local governments. Related agents from various fields will participate and frequently discuss ways to improve health and medical situation in North Korea. It will develop into a sustainable community that protects health and peace not only on this peninsula but around the world. In tandem with the launch of this platform, the Governors Association of Korea will also actively take part in terms of invigorating health and medical cooperation on the Korean Peninsula and guaranteeing the right to life and health of the residents of this peninsula. Congratulations once again on the launch of the platform. Thank you.
Thank you very much. That was a great and inspiring remarks. Thank you. And once again, please give them a big round of applause. Next, we will have congratulatory remark from Chairman Lee Kwang-jae of Foreign Affairs and Unification Committee of National Assembly. Please welcome him with a big round of applause, please. I am Chairman Lee Kwang-jae of Foreign Affairs and Unification Committee of National Assembly. When you have water from or drink water from a well, you have to remember who created or funded this whole well. So we have to remember who really set this whole starting point. So in this regard, I'd like to thank you. So please give a big round of applause for everyone, because we are the one who really created this whole starting point. I looked into the topics of today's platform. It's about the water and the response to disasters and the clean water and the food and the other important issues will be covered in the sessions. To succeed this platform, I think there are fundamental obstacles that we need to tackle. First, it's about the humanitarian aid and also the economic sanctions regarding this North Korean nuclear program must be separated. For the humanitarian aid, we need to be active to support on the humanitarian front. And second, when we have this support, the human rights issues have been always surfaced as an issue. I think the human rights issue is also about protecting people from hunger and poverty, and the other side of the human rights issue is about these political and social human rights. But we have to remember that human rights also entail these other aspects of the hunger and poverty. That is also about protecting human rights. We have to remember that and make it clear. And third, when we offer the aid, we have the monitoring system of the world. So when we have effective monitoring system, we can be more effective in offering the aid. When we provide the milk to the children in North Korea, the UN measure the size of the children to check or monitor whether they are really getting feed from this whole milk. So when we offer this humanitarian aid, then we have to work with the international community to monitor the programs are well implemented as expected. And the COVID-19, the pandemic, we are having these vaccines and the cures coming up. So I think we want to see more forward-looking support and aid for North Korea. In terms of hunger, I'd like to mention a few things for North Korea. In Korea, we have over 1 million tons of the rice inventory, and it takes like 400 billion won to get rid of this oversupply of rice. So we have to tackle this hunger problem of North Korea with the supply, and the iodine of North Korea is now in a short supply, so that really undermines the development of the children. So it doesn't show today, but in a few decades, it will be a huge burden on South Korea. So on that point, I'd like to ask special attention of the health and medical community. And also, many Chinese ships go to the North Korean seas, and they are doing a lot of fishing. And we should help North Korean people to get the right amount of protein, animal protein from fish. When I tell people about these ideas, people ask about how we can get the international community support. Well, during the Second World War, President Roosevelt supported the United Nations by lending weapons to Europe. At the time, in the U.S., there were some resistance or opposition from within the United States. So the Roosevelt president came up with a law to lend weapons to the European countries, which was effectively a good way to support the war or support the fighting against the war. So in that regard, we need to win the support of the international community and lead the unification of the people on the Korean Peninsula. And to that end, we can benchmark the idea of President Roosevelt so that we can emerge as an advanced country. Both Korea can really prosper. We want to turn two Koreas into a great place to live. Thank you very much. Thank you very much, Chairman Lee, for your congratulatory remarks. And once again, please give him a big round of applause. And next, we have a special message from the international community to celebrate the launch of Health and Medical Cooperation Platform on the Korean Peninsula. Director General Tedros Adhanom Ghebreyesus of WHO and Chair Jose Manuel Barroso of Gavi Vaccine Alliance. We will watch the video.
Your Excellency, Mr. Lee In-young, Excellencies, dear colleagues and friends, the COVID-19 pandemic is a stark reminder that international cooperation, collaboration, and solidarity are critical in the face of shared health threats. WHO's constitution, which entered in force in 1948, affirms that health is not just a human right, it's fundamental to attainment of peace and security. That remains true today. History teaches us that health is one area in which nations can join hands across ideological divides to solve shared threats. At the height of the Cold War, the United States and the Soviet Union came together to eradicate smallpox. We need that same cooperation now, which is why we believe the time has come for a binding treaty on pandemic preparedness and response to create an overarching framework for a shared response to shared threats. In the same way, I welcome the launch of the Health and Medical Cooperation Platform on the Korean Peninsula, and I congratulate the Ministry of Unification for this initiative. I hope it will contribute to health, peace, and prosperity for all people on the peninsula. WHO remains committed to working with both the Republic of Korea and the DPRK to realize a healthier, safer, and fairer future for the people of the Korean Peninsula and the whole world. I thank you. 감사합니다.
Your Excellency, Mr. Lee In-young, distinguished participants, ladies and gentlemen, it is my great honor to join the inaugural meeting of the Health and Medical Cooperation Platform on the Korean Peninsula. Gavi, the Vaccine Alliance, helps vaccinate almost all of the world's children against deadly and debilitating infectious diseases. Since its inception in 2000, we have helped vaccinate more than 888 million children in the world's poorest countries, preventing more than 15 million future deaths. Gavi has a long history of engagement with the Korean Peninsula. From 2000 to date, Gavi has been protecting the health and lives of the children of the Democratic People's Republic of Korea through its support of 6 vaccines and strengthening their health system. The Republic of Korea became a donor to Gavi in 2010, much earlier than their Asian peers. Korea's financial support has steadily increased ever since. However, it's not only about the funding. Gavi's relationship with Korea embodies this very spirit of the alliance, a partnership. In addition to the government, Korean vaccine manufacturers play a critical role in providing life-saving vaccines globally. We also worked with the International Vaccine Institute, IVI, on the R&D front. Today I see the same spirit in diversity of the founding members of this platform, representing public and non-public sectors. Since COVID-19 and the ongoing pandemic, Gavi's partnership with the Peninsula has continued to deepen further. Together with the Coalition for Epidemic Preparedness Innovation, CEPI, and the World Health Organization, WHO, alongside key delivery partner UNICEF, Gavi co-leads the COVAX facility, the vaccine pillar of the Access to COVID-19 Tools Accelerator, or ACT-A. As a global mechanism, COVAX was created to accelerate the development of COVID-19 vaccines and the scale-up of their manufacture in order to make access to them fair and equitable for people in every corner of the globe. The Republic of Korea is a participant of COVAX and the donor to the COVAX Advanced Purchase Commitment mechanism that is designed to secure hundreds of millions of doses of safe and effective COVID-19 vaccines. The vast majority going to people in the 19 lower-income countries that would otherwise struggle to get access, including the DPRK. Regarding COVAX AMC, I would particularly like to thank the Korean government for the pledge of $200 million made by President Moon at the G7 summit in June this year. We recognize that this is the largest Korean pledge to Gavi and other health-related organizations. Combined with the contribution of SK Bio, a Korean manufacturer of AstraZeneca vaccines, this makes Korea one of COVAX's most committed and distinguished contributors. This kind of support is absolutely essential to bring this pandemic to an end, because, as we have seen with COVID, no one is safe until everyone is safe. As Gavi has long stated, infectious disease knows no borders. I hope today's meeting will be a great first step to start such collaboration in the Korean Peninsula, and then the same spirit will evolve globally. I wish you a successful and fruitful meeting. Thank you.
Thank you very much. 2 gentlemen couldn't join us today due to the external circumstances, but let me thank you once again on behalf of all the participants here for sharing inspiring message out of your busy schedule. Now we will move on to the most important part of today's program to read out Joint Declaration of Health and Medical Cooperation on the Korean Peninsula. Let me invite guests to read it out to the stage. Minister Lee In-young of Unification, Vice Minister Yoo Geun-hyuk of Health and Welfare, President Song Ha-jin, Director General Jerome Kim, President Kim Young-hoon, Executive Director Lee Jun-mo, Chairman Lee Gi-bum, please come up to the stage. Joint Declaration of Health and Medical Cooperation on the Korean Peninsula is prepared by gathering diverse feedback from participants here to set common vision, goals, and future directions that all the platform participants can share. I hope the joint declaration will mark an official launch of Health and Medical Cooperation platform on the Korean Peninsula as an open platform for win-win and cooperation. So when the declaration is delivered, we will start. Starting with Minister Lee In-young's reading out the preamble, each representative will read a paragraph one by one. Minister Lee, please.
Joint Declaration of Health and Medical Cooperation on the Korean Peninsula. We view that it holds significance that cooperation on protecting the lives of all people on the Korean Peninsula and on ensuring healthy and prosperous lives of the people continues amid global health risks regardless of political and security situation. Under the mutual understanding that those efforts to this end shall be made with the solidarity and cooperation of us all, today we proclaim as follows the occasion of launching of the Health and Medical Platform.
We shall create a community of life and safety on the Korean Peninsula in response to imminent and potential health risks through reciprocal cooperation from the perspective of peace and prosperity and coexistence on the Korean Peninsula. 2. We shall make the health and medical platform on the Korean Peninsula as a venue of collective knowledge as well as a community open to whoever has interest in health and medical cooperation on the Korean Peninsula.
Then welcome that South and North Korea work together to implement sustainable development goals of the United Nations and shall put utmost effort in cooperation with the international society to this end.
4. We shall encourage joint actions at the Korean Peninsula level to respond to global health issues threatening the health security of the international society and shall pursue the Korean Peninsula where all the people in North Korea as well as South Korea enjoy healthy lives through inclusive cooperation on enhanced medical health system.
With a humanitarian spirit and shall cooperate and support them based on the respect for individual pursuits of all the participants of the health and medical cooperation on the Korean Peninsula.
We agree that it is critical to develop the health and medical platform on the Korean Peninsula as a sustainable community. Thus, we shall hold a regular meeting once every year and shall make effort to develop the platform through virtual cooperation as well. November 10, 2021, agreed by all the participants of Health and Medical Platform on the Korean Peninsula. Please give them a big round of applause. That was the reading out of Joint Declaration of Health and Medical Cooperation on the Korean Peninsula. Now 7 representatives on the stage will now take a photo op. Just stand there, we will take a photo op.
Hello, everyone. I am the moderator for Session 1, Professor Kim Shin-gun at Korea University. Well, I believe we can think about the lessons that we learned from COVID-19, that every life is all interdependent and it is dependent on each other. And this goes for both Koreas and the lives of the Korean Peninsula. So our first keynote speech will be made by Mr. Shin Hee-young, the president of the Korean Red Cross. Please give him a big round of applause. Good afternoon, everyone. As we heard from our ministers, they were here for the opening ceremony, and now we have more room actually. After that, they have left. Today, I am going to talk about the health and medical platform on the Korean Peninsula. And it takes more than 2 hours, actually, to really have an in-depth discussion on this topic. And I only have 20 minutes at hand. And I wasn't expecting so many foreign guests today who are here today. I would have made it in English, but as I know that there is simultaneous interpretation service, so let me go on Korean language. My wife this morning asked me, what is your schedule? And I said, well, I am going to have a keynote speech at the Unification Ministry. And her response was that, well, you are talking about the same topic over and over again. So that is correct. I have my slides that are almost the same for many years, and I got to think, why aren't we having any changes so far? And I believe that the time will come and is coming to change the concepts and change the messages in my slides. Well, we have to think about why there is a need for inter-Korean exchange and cooperation in the health and medical field. This is because around the world there is only one country on this globe where we share the same language, however we have different regime. And North and South Korea will come together, will become one, and I believe that will be the laying foundation as we go forward. And when that happens, an integration without a foundation of a health or a health community is a prerequisite. We cannot think without that, and that is why we are gathered here today. In 2018, we had some dialogues happening, and back then it felt as if it was imminent that the dialogues will resume. As you see here on the slide, Minister Kwon is in this picture. He was vice minister when we took this picture. It was in September when we had the agreement, and in November we met for an exchange. However, after that, soon after, the inter-Korean relations came to a halt again. For the two Koreas to become one, we first have to know about North Korea well, and we need to be well versed. I went to North Korea for eight times. However, I'm still not confident about what I know. The knowledge that I have, I'm not sure if this is correct, because I have I'm very skeptical if I am touching the trunk of an elephant, and maybe it's not really the trunk of an elephant, but a snake. You never know what it is. So in this regard, we have to know exactly the status quo of the two Koreas on their medical situation. Ever since the war, North Korea has introduced the basic socialism and basic concept of socialism, and this is why they have free medical system, free universal health coverage, and their emphasis is heavily on preventive treatment. They also have a section doctor system, and in the 60s and 70s, due to this system, they had a superior system compared to South Korea at that time. So they have from Lee-dong level clinic to Central Hospital, they have a very well organized hierarchy and a medical delivery system, and that medical delivery system is still maintained till today. And to this end, we have to find there is a differentiating point compared to the African countries, because they do have a system that is in the background. And around the nation, they have more than 6,000 polyclinics or clinics. They have county and hospitals. They have central provincial hospitals, and so on. So they have a very firm and system that is already established. However, in 94, 95, during their North Korean famine or arduous march, they had seen an unofficial medical delivery system. And when we were there in the 2000s, we were seeing a collapse of this medical system of North Korea. In 2010 to 2015, Kim Jong-un's era was about to begin, but actually what you see here is the priorities from Kim Jong-il's regime. And their first and foremost priority was the reduce of the burden of infectious diseases. And when Kim Jong-un took the power, things changed. So it went to more of a computerized system of medical system, and also modernization of hospitals and pharmaceutical factories. And he was overseeing it himself, Chairman Kim, and he also established a pharmaceutical company. Maybe this was the impact of his studies overseas in Switzerland, but anyway, he was doing a lot of field supervising on these type of pharmaceutical factories. So it feels, and we can have a feel that things are changing. Things started to change, and North Korea has also made specialist hospitals specializing in breast cancers, specializing in children, and so on. And they have also Pyongyang General Hospital that the building itself is completed, but it has not opened yet. So looking at the key focus areas on a national level from 2016 to 2020, you can see that there's a change, that they are focusing more into the area of medical science and technology development, or telemedicine system, and information-oriented change. All in all, we can look at the indices, different indices of major health indicators. We can look at the life expectancy difference, and we have a lot of data coming out, as you can see here. But for me, personally, I don't have faith in these data, because these data that is being reported to the international community, I believe it could be fine-tuned to some extent. So whenever I see a data coming out from North Korea, I always put 3 times more into that figure itself. So I believe there would be a discrepancy between the actual data and this data that you're seeing here. And this malnutrition status, I believe it will be higher than it is reported to the international community. And WHO and these international organizations are giving out a lot of reports. However, I'm quite skeptical about if this is the accurate situation. And the medical personnel training institutions, it's quite a system that you have here, and it looks as if they have much more medical staff, not much more, but 1 more medical staff per 1,000 population compared to South Korea. So this is based on the data that they reported to WHO. And health security concept, let's look at the background and the necessity of the emergence, because the concept of health security, I believe that it would have been there. And why it is so important is because North Korea, they are seeing a lot of cases of tuberculosis, and it's prevalent. So when we talk about North Korea nuclear weapons, when they say there are more than 1,300,000 nuclear facilities or weapons, people get really startled. However, this nuclear is for tuberculosis, because they share the same Chinese characters for nuclear. So it's the prevalent status of TB in North Korea. And when we talk about denuclearization, I don't actually mean denuclearization of the weaponry, but of the tuberculosis situation in North Korea. And since I'm from the Red Cross, the most concerning point is the people or the soldiers who are stationed in around the armistice line, they cannot donate their blood because of malaria situation around this area of the border. So that is why I believe the introduction of health security concept is imminent, and it should take utmost importance. And we had a joint project with North Korea to eradicate malaria around the armistice line, and it really helped actually. And the risk of transmission of zoonotic diseases, this is one of the priorities that North Korea is focusing on these days. One of the main supply of protein to North Korean people was pork. However, due to African swine fever, they cannot use pork anymore. So now it is more focused on hare and goats. So we have to come up with a vaccine to eradicate African swine fever, and this will help North Korea in terms of their proteins supply. As myself, a member of this Okgaedongmu Children Hospital, I was involved in these projects of completing 3 hospitals in North Korea. This was opened in 2004. It was more focus was on diarrhea and nutrition disorder in children. And then we had this rural hospital in Janggyeori, and also a pediatric ward in the Pyongyang Medical University. And what I learned from this project was that there is a big gap between North and South Korea. The disease patterns are widely different. North Korea, they are bacterial disease focused, and South Korea, they are viral disease focused. Actually, this was the situation for South Korea in the 1970s and 80s. However, as the country and economy developed, the viral disease started to prevail. This is an important point that since North Korea has a prevalence in bacterial disease, there is a possibility that all the children will be gone because of these bacterial diseases. And for South Korea, viral disease, we do have vaccinations and cure. However, this is also a great burden in terms of health situation. So as a pediatrician, I believe it is my mission to resolve this big gap between the 2 Koreas, because both points are concerning. So let's look at the estimated unification cost. And just looking at Germany just prior to unification, we would need 40 trillion for 5-year period, and this cannot be resolved with just by South Korean contribution. And since I'm a professor, and I was a professor for 3 decades at medical college, I came to a conclusion that we need to pay more attention and do more research. After Kim Jong-un took his seat, there was an order from the supreme leader to submit this SCI level papers, and that is why we're seeing a surge of SCI level papers by North Korean researchers. And if we can cooperate to this end, we believe that this will be a great starting point. And that is why we came up with about 40 different categories where we can cooperate. And amongst it, the natural drug area will be an area that we can cooperate very well, and it's quite lucrative because around the geography near North Korea, they have a lot of natural drug materials that we can cooperate. And also, they have new drugs for tuberculosis and rheumatism as well. 3 years ago, in China, they use sweet wormwood for a cure for TB. If we can cooperate on something like this, we believe we can come up with at least 10 of great cure or treatments that is in need. Also, parasitic infections, tuberculosis, R&D cooperation. We can cooperate up to this front, and we can also use appropriate technology. A self-fluid manufacturing machine could also be one of the things that we can cooperate. And if we can do that, this is a way for coexistence. And this will also contribute and be the foundation for a peaceful cooperation and exchange. North Korea is really against humanitarian aid. So it's not about a humanitarian aid that we're talking about. It's more about a exchange in cooperative R&D, and this will be much more accepted and received by North Korean people. And from this point, we believe that this is a shortcut to a rapid modernization of North Korea, and without the taxpayers' money from South Korea. And this will be a smooth and seamless integration in terms of health and medicine of the two Koreas. So the health and medicine cooperation should be an opportunity for coexistence. Thank you very much.
Thank you. Thank you very much, President Sin. You are just on time. So for the session 1, we have a platform, so many people will present, and we have 14 panelists waiting for the session 1. So I think the timekeeping is really important because we have session 2 later. So panelists, please make your presentation to 4 minutes each, and 30 seconds before it's over, we're gonna set you an alarm. So I know that you are very careful and generous, so please make your presentation in 4 minutes, so you can just say your conclusion and then add to that, then you can make yourself clear. So let me invite the first panelist. We don't have time to introduce all the career and the introduction of all the speakers, so please refer to this screen. We have Mr. Yang Dong-gyu, Director General for Planning and Coordination of the KDCPA.
Hello, I am from KDCA. First of all, I would like to congratulate the Health and Medical Cooperation Platform, and the launch of the platform, and I would like to commend all the organizers and the institutions who are involved. As we have seen seismic change due to COVID-19 situation around the world, the cooperation between the two Koreas in the medical and health sector is greatly needed. And in 2018, we had an agreement with North Korea about cooperation and information exchange, and I expect this to resume. The Korean government from 2001, we are pursuing this inter-Korean cooperation, medical cooperation, and through WHO, we are supporting North Korea in terms of malaria project, in their medical supply and so on. And ever since, for a decade, we are enhancing more supply and support in terms of malaria in North Korea. And this came to a result that the malaria management was in a stable manner in North Korea. And with in cooperation with NGO, we supplied vaccinations for children for measles and malaria, and also avian flu and MERS, as well as Ebola. The treatment, and the preventive supply was said to be supported by South Korea. And our meetings, we had imminent and immediate measures to strengthen the medical cooperation, and due to this, from 2018, we supplied TB, malaria, and influenza information exchange on this communicable diseases. We never know what is going to happen in the future, and the novel communicable diseases that can emerge. It is urged that the rapid stabilization of this medical cooperation between the two Koreas is needed. And from 2018 onwards, the agreement that we had back then, we are going to resume the information exchange with North Korea. And not only this regional consultative bodies and cooperation with international organizations such as WHO will contribute to the sustainable relationship with North Korea in terms of medical cooperation. The medical area is important, and the close collaboration is very much needed. And for this, not only government, but also the experts and organizations from home and abroad, their roles are critical as well. Just as we've seen so far, I hope and I wish for your support, your unwavering support. This health and medical cooperation platform that is being launched today here, I believe that this will be a key stepping stone towards a close cooperation. In 2018, we have agreed on a declaration that the two Koreas will seek various ways to have a brisk exchange and also a firm cooperation. And I believe this will not just be in words or document, but actually lived out by the government and the related bodies. Thank you.
Thank you very much. We will move on to the second panel. Representing the municipal governments from Seoul Metropolitan Government, we have Park Ji-young, Director of Development Cooperation Division, Inter-Korean Cooperation Bureau. Hello, good afternoon. I am Director of Development Cooperation Division from Seoul City Government. First of all, congratulations on the platform inauguration. It is a really meaningful adventure that we are now taking, and as was mentioned before, it has been the international communities or organizations and the central and the municipal government and the NGOs have been working for the same goal, but in some ways we've been seeking different paths. So I think taking this opportunity, we can overcome the past obstacles and we can make tangible progress in this regard to cooperate between South and North Korea. In this regard, the health and medical cooperation platform on the Korean Peninsula will be a really important milestone in changing the future with strong strategies, and we hope that the participants can really work together for effective cooperation and also the open solidarity and the cooperation. We want to see more opportunities for inter-Korean cooperation so that we can build and seek changes for all the people on the Korean Peninsula. As you know, in the mid and late 1990s, the North Korea had its North Korean famine, but still they are suffering a lot. So the elderly and children and the pregnant women are now suffering. So we need to provide and continue to provide this humanitarian aid for the North Korean people. And the municipal governments will also do its part to improve the living standards of the people, and we have been making great progress that fits the interest of the municipal government, although it's sad that we have not making that much progress as we expected for the past few years. But we hope that this platform can be a great platform and framework to coordinate differences between the central and the municipal governments, and we want to have a great opportunity to narrow the gap between the diverse participants by engaging in in-depth discussion. And we had this G20 summit meeting, and one of the agenda was that we are now having this economic and the health and medical crises due to the pandemic, and we are also struggling to fight against this security and the climate change and all these challenges. So there are efforts being made at the international community, SDG, VNL, and UPR, and including the private and the public sectors. All the experts are now working on to make great strategies, and we expect that we will have great findings from these collective efforts. Yesterday in the Norong Daily, there was an article where it said that the North Korea is now caring about this medical checkup for the people. And also in June, they had this 8th meeting in in the DPRK, which will be about having this 10 agenda to cover the food and agriculture, and also the child care policy. And the Kim Jong-un leader also mentioned about the green growth. And this whole idea was about feeding milk to the children for their health and also for the green growth. It was about to seek effective national development with forestation. So to summarize, in terms of this health and medical cooperation, we need to look into their needs and the clean water and the climate change, and we need to have a well-organized strategy. And also at the same time, inside our own society, we need to revisit our way of cooperation and thinking by looking into these issues, how to get the public acceptance and effective implementation. I hope that this platform will be a great opportunity to seek win-win and coexistence and effective cooperation. Thank you for listening.
예, 감사합니다.
Thank you very much. Our third speaker is Yoon Sun-hee from WFP Seoul Office Head. Thank you very much.
Take part in this important event today. Let me add my own congratulations to the Ministry of Unification and the organizers as well as the participants on the meaningful launch of an important platform for future cooperation on the Korean Peninsula. The United Nations World Food Programme is the world's largest humanitarian organization fighting global hunger. Last year, we reached 115 million people in over 80 countries with food and nutrition support. At a time when 270 million people are facing hunger worldwide, with conflict as a major cause compounded by climate extremes and exacerbated by COVID, this task has never been more difficult or urgent. We exist to serve the vulnerable communities in need wherever they may be. Last year, we were truly honored and humbled to be awarded the 2020 Nobel Peace Prize in recognition of our efforts to achieve peace in a troubled world. But WFP does not act alone, and we simply could not save lives and change lives without the tremendous support of our partners like the Republic of Korea. Republic of Korea graduated from being a WFP recipient country in 1984 after 20 years of receiving our assistance, and has since now become WFP's 11th largest government donor. Republic of Korea is a shining example of playing a leading role with its own experience of achieving zero hunger in a single generation. At WFP, we have a long history of partnership and cooperation with the people of the Korean Peninsula. For many years, we have worked with the Democratic People's Republic of Korea and the Republic of Korea to ensure that every child, no matter where they live, is healthy and has nutritious food to eat. WFP has been present in DPRK since 1995, providing nutritious food to mothers and children under the age of 12, and making significant progress in reducing levels of child malnutrition. WFP supporting DPRK in achieving zero hunger in a manner that protects food security and nutrition gains, especially among children, pregnant and lactating women and children, and other nutritionally vulnerable groups. Poor nutrition is particularly problematic for young children, pregnant women, and breastfeeding mothers, as good nutrition is crucial in a child's early years. And without the right food and nutrition at the right time, consequences for a range of health and development outcomes can be much worse and in fact irreversible as they get older. Nevertheless, today, chronic hunger is a fact of life for millions of people in DPRK, caused by a diet short on essential proteins and micronutrients. Our programs run in partnership with the government of DPRK and provides most of the food eaten by the women and children enrolled in our programs. WFP's specialized foods provide essential vitamins, protein, energy supplements for these children at the most critical times of their lives. For success in promoting food security and nutrition in DPRK critically depends on cooperation with many stakeholders: government agencies, private organizations, local government, academia, not to mention the international organization. And health and nutrition issues in DPRK are a global challenge, which means we all have to come together. I think I have run out of time, but in closing, perhaps I can just simply say that our approach in DPRK is designed to treat and prevent direct causes of malnutrition, complement programs that address underlying factors as hidden hunger. It is not just about providing humanitarian assistance. WFP is committed to playing an integral role in inter-organizational initiatives and platforms in government-led partnerships with UN agencies, NGOs, civil society, business, and academia alike. I'm very grateful to the government of the Republic of Korea for its efforts to build peace and support sustainable development across the peninsula. Every single one of us can contribute to this life-saving mission, and if we work together in this partnership, I'm hopeful we will one day be able to keep and build a brighter future for the children of Korea and beyond. Thank you very much.
Thank you very much. Now we'll move on to those who are joining from online. From Stop TV Partnership, we have Lucy Kaditu, please.
Hi, hello, good morning. Good morning from. Thank you for inviting me to be here with you, and I think it's a great initiative that you are putting on place. I work for TV Partnership. I'm the executive director. We are a United Nations hosted structure aiming of ending TB in the world with more than 20 years of existence. Since year 2000, we actually have a very strong engagement and support to DPRK, especially in trying to help, together with other partners, the country to end TB by 2030. And the main areas of support, even though we never had a collaboration in terms of, as a donor with any of the Korean or Asian countries, we managed through our other donors from other parts of the world to still support the region. And the DPRK, especially in the area of products, of providing drugs and commodities, quality assured for TB, we basically treatments, as well as supporting their advocacy efforts, trainings into the procurement and supply, as well as partnership. And this was consistently since the year 2001, and actually intensified over the last years, including the fact that for the last 2 years we hold a monthly call with different partners throughout the world, that including our colleagues from WHO and Global Fund and many, many others, that trying to coordinate the efforts in addressing tuberculosis in DPRK. The situation is, I'm not going to go into the epidemics of TB. DPRK is one of the very high burden countries with a lot of TB, but a lot of drug-resistant TB. In 2019, I, together with my team, visited last time DPRK Afterwards, as we know, unfortunately, the pandemic started. My team used to visit regularly, but since July 2019, none of us visited anymore. In spite, and I think what is very important in all these conversations that are taking place is to really understand not only the situation, but where we stay right now. There is wishful thinking, and there is a huge need for our collective collaboration and support in the country. It's not for me to tell you about the urgency and importance, but what is happening is over the last 2 years, there is very little, how to say, opening, even on the simple basic receiving commodities and the drugs. For TB, we know for sure that the country is in shortages of first line and second line drugs, as well as even more dramatic diagnostics. From our last interaction with our colleagues dealing with the TB program in the country, anything that is needed for diagnosing tuberculosis, even for smear microscopy. I'm not speaking for the most recent advancement, but even for me, smear microscopy was missing. When I visited in 2019 the country, though, the knowledge of the doctors was exemplary, was fantastic. And the system in place, having primary health care as well as the dispensaries, was also working very well. What was dramatically missing was not the knowledge, where the products, where the tools, the real tools to be put in place. And the country has a very generous grant from the Global Fund. We are there to help as well. But unfortunately, even the drugs, which were ready to reach the country, were stuck for a long time in China. So I want to thank you very much. I think it's a very good initiative here. We are continuing to support, and we will continue to support DPRK. The shipments seem to be resumed, but we have a long way to go. And I think the country and the people of the country need a lot of support. Thank you very much.
Thank you.
For your insightful and informative remarks.
Next, we have our fifth speaker, Chae-Hae-kyung, Secretary General of Assocation Children. Hello, I am Chae-Hae-kyung from Assocation Children. Today, I am here, and the speaker right behind me, Mr. Hong Sang-young, we are going to speak about this, our standpoint of this private organization on North Korea cooperation. And I would like to speak about the principles in terms of our cooperation. And amidst this COVID-19 pandemic, it's very startling to think about how interconnected we are. We are living in a community where we it is inevitable for us to have an interdependence with each other. And for us to realize a life community on this Korean Peninsula, I believe that this platform launch is very meaningful. And it should not be in only words, but I hope that it is carried out in action. And as we look at the health and medical cooperation platform, we have such expectations. However, we have to look at this sober situation that we have obese children in South Korea. However, we have malnutrition prevalent in the children of North Korea. And how can we say that this is a health community on the Korean Peninsula? It is quite pitiful that this is the situation as it is. So this humanitarian aid to North Korea is difficult due to the economic sanctions against North Korea. And the essence of this cooperation is to make North Korea go beyond this difficulties. So I would like to propose the followings. First is, I hope that the South Korean government can actively cooperate with the U.S. government to supply abundant amount of vaccines to North Korea so that they can solve the issue. Second, we hope that you can solve this issue of stalemate in the Korean Peninsula. And third, the COVID-19 preventive supplies and sanctions on these supplies should be addressed together with the U.S. Fourth, I would like to ask for the modernization of this health system in North Korea so that this could contribute to the forward-looking relations of the two Koreas in terms of medical cooperation. This platform that is being launched today, I hope that it will contribute and be the first step towards a life community on the Korean Peninsula. Thank you.
Moving on, the sixth panelist is Hong Sang-myung, Secretary General from Korean Sharing Movement, please. Hello, I am Hong Sang-myung, Secretary General from Korean Sharing Movement. And President Shin made a great keynote speech. I will talk about the health and medical cooperation between Koreas and about the platform. I think the private and public sector can play an important role, and the central government also can play a role. That will be what I want to share with you. Still, the government should take the lead, and that makes sense. And some other organizations or the stakeholders agree to that. Between North and South Korea, people think that we have to deal with this political and military issues. But for the 30 years, given my experiences in the field, well, even though we take the priority on resolving the political and diplomatic issues, that will not address all the issues that we face. That will not be the one single solution. As we launch the health and medical cooperation platform on the Korean Peninsula today, stakeholders want to have the cooperation, but once we start the interaction with North Korea, people may want or expect that the government should take the lead. When we had a peaceful time or relations with North Korea, people claim that the private sector only was a bystander in the process. So inter-Korean issues can be solved, and people think that the government role is more effective and efficient, but that may undermine the sustainability of these whole endeavors. So today we are having not that good relations between the two Koreas, but we want to launch this platform because we want to talk about the real life issues of the public, and we want to seek solutions, creative solutions where we can tackle both issues. The political and military and the diplomatic issues can be also played or tackled by the government, but for the private issues like the society and these health and medical issues, the private sectors need to play a role with the government, opening up the foundation and platform, and the government need to open up and provide information through the platform. There are a lot of data and statistics on North Korean status, and the government has an ample amount of the data. First of all, this whole data and information should be made available to the public. So, for example, when I was or worked for the Committee of the Unification, there was a lot of research projects that were carried out by the government. But these whole data and findings were kept confidential, and that was not shared with the private sector. So these are really valuable findings and the research, but these are not really shared by the private sector. So that is why we don't know much about North Korea's situation, and even though the information is available, it's only shared with only a minority of people or the sectors. So all these cooperation should start from fully understanding the current status. So I would like to ask the government to share this data and the research findings with the private sector. So that's it. Thank you very much.
Thank you. The next speaker is Korea Foundation for International Healthcare Division Head Choi Sung-jung. Hello. I am from Korea Foundation for International Healthcare. Today, I would like to congratulate the launch of Health and Medical Cooperation Platform on the Korean Peninsula. And due to this joint declaration that we just heard, we believe that this will be a great opportunity, and it really is overwhelming to take part in this platform. Our foundation, through this projects to support North Korea humanitarian way, we are doing this since 2001, and I completely agree with President Shin's keynote speech. The health and medical cooperation is about life, and this medical cooperation is a universal value, and it is right to health that everyone is entitled with. But at the moment, the situation that we are facing here is that the gap is widening between the two Koreas, and we all know this as a fact. And to close this gap, both Koreas should work towards this to close the gap, and I believe that this is a great starting point to declare the will from our side in terms of building this cooperation platform. We believe the Ministry of Unification should take the lead, and also the Ministry of Health and Welfare should be in cooperation with the Unification Ministry because this medical area is a special area that needs expertise. And the medical technology and should be there, and the management of this technology as well as a decision-making ability for smooth operation are needed. And to decide on the strategic decision, we have served as a think tank, and to this end we cooperated with many different actors such as NGOs and experts. We are always in a preparedness mode so that we can prepare for a call for our role, and we have published a white paper, and this will continue in the future. The universal value of achieving health is the utmost priority, and we believe that all participants should work towards this direction. And this secretariat, the liaison office, is established, and we believe that this should take more roles in terms of close cooperation. Our foundation will do our utmost towards a healthy Korean Peninsula and the healthy lives of the people on the Korean Peninsula. And we are going to share our expertise and specialties in terms of medical cooperation, and based on the fellowship that we have with North Korea, we are going to carry on with the post-COVID-19 era cooperation in terms of medical and health area with North Korea. We believe that we can contribute to this end. I hope that we can cooperate more with the specialists from home and abroad so that we can materialize the social values, universal social values, and to contribute to the medical cooperation on the Korean Peninsula. Thank you.
Thank you very much. And we will move on to the eighth panelist, Oh Yang-seop, Secretary General of the KNTA. Hello, good afternoon. I am Secretary General from the Korean National Tuberculosis Association. It is a really meaningful opportunity, and I'd like to thank Ministry of the Unification and all the other associations and for having this great opportunity. Today, the whole humanity is now suffering from the COVID-19. So the tuberculosis is also a respiratory disease. In Korea, every year, we have about 20,000 patients every year, and also about 1,600 people die from tuberculosis. Of the OECD member countries, we have the #1 in terms of the tuberculosis disease rate, and the #3 in terms of the death rate. And every year, TB causes a lot of deaths, and that is even more than the deaths caused by COVID-19. And the mortality is like 5.31, and that is larger than 0.78, so it's higher than the COVID-19 mortality rate. So likewise, TB is not just for the whole world, and for Korea is causing a lot of burden, social burden. So tuberculosis is or can be an agenda that we can discuss for the inter-Korean cooperation. In North Korea, they have 530 people out of 100,000 people, so it has the 8th country in terms of the TB damage. Or in North Korea, the mortality rate is like 7 times higher than Korea, and the resistance rate is like 6 times or 16 times. So it is really dire situation in North Korea. And the global funds and the international community have been implementing the PB drugs and the supplies programs, but due to the COVID-19, the logistics have been stopped, and delivery and shipments have been stopped, and it's not really clear whether we can continue the supply of the drugs and the whole goods that they need. So we need to make really tangible efforts to address this crisis. Recently, the administration of President Moon Jae-in is working to end the war, and the health and medical cooperation can be one starting point to start the humanitarian aid. And TB can be one important area where both Korea's and the international community can work together, because it's a really important area. The KNTA since 1990, BCG vaccine and the TB drugs and the diagnosis supplies have been provided to North Korea. And also, we also invited the people from DPRK to hold a seminar to support them with TB cure. And by having the consensus and by sharing our experiences at our association with the international community, we are taking proactive measures to eradicate TB, and that can be an important and feasible option to tackle TB in North Korea. And for the Ministry of Unification and the associated partners and organizations, I would like to ask your active attention and the interest and support. Thank you very much.
Thank you. Next, we have Mr. Patrick Swayze from Konrad Adenauer Foundation.
Dear ladies and gentlemen, first of all, thank you very much for the invitation. I truly enjoyed the very informative keynote speech by Professor Shin, and I think it greatly illustrated the immense need as well as the potential of increased health cooperation on the Korean Peninsula. My name is Patrick Schweiss, and I work as a project manager for North Korea-related projects in the Korea office of Konrad Adenauer Foundation in Seoul. It's my pleasure and honor to be here today to take part in the roundtable plenary meeting on the occasion of the proclamation of the Joint Declaration of Health and Medical Cooperation on the Korean Peninsula. Perhaps it is best to start off my short comment with a brief insight into the nature and purpose of our foundation and why we are active on the Korean Peninsula, as I can imagine that not everyone here is familiar with our work. Our foundation was founded in 1955, and it was named after Konrad Adenauer, who was the first Chancellor of the Federal Republic of Germany. And having close ties with Germany's conservative party, the Christian Democratic Union, CDU, the foundation's initial focus was to foster political education in Germany. Today, however, our foundation has evolved quite noticeably and does much more than that. We act as a political think tank and strive to foster peace, democracy, and sustainable development worldwide, and to this end, we are running offices in well over 100 countries all around the globe. Our office here in Seoul was established a little over 40 years ago, and ever since we have been active in promoting relations and joint projects between Germany and Korea in areas such as democracy, innovation, as well as security. The common experience of a national division between Germany and Korea makes for a special bond, and therefore engaging for the improvement of inter-Korean relations and providing insights into German unification are important aspects of our work here on the peninsula as well. We strive to foster enhanced international integration of the DPRK and work to promote issue-centered and multilateral dialogue and exchange with the country. We have found that the fields of sports and health are very well suited for this purpose, and strongly believe that these areas can also serve as venues for improved inter-Korean cooperation and exchange. In this context, we very much welcome the proclamation of the Joint Declaration of Health and Medical Cooperation on the Korean Peninsula, as well as the establishment of a health and medical cooperation platform. I think the COVID-19 pandemic has shown us all how essential and at the same time challenging international cooperation and coordination on health-related issues can be. As shown by Professor Shin, apart from COVID-19, there are specific ongoing challenges on the Korean Peninsula like malaria or tuberculosis, and I think this really demonstrates the urgency for increased international and regional health cooperation. We hope that this initiative will grow to be a central venue for coordinated and sustainable health cooperation, and a platform of this kind will certainly facilitate joint projects by actors from various backgrounds and strengthen prospects for inter-Korean cooperation. We are confident that jointly coordinated efforts will enhance the overall ability to tackle health-related issues and challenges in the region, contributing to increased well-being of the population. Thank you very much.
Thank you.
Our 10th speaker is Mr. Kim Soo-am from Korea Institute for National Unification. Hello, I am Kim Soo-am from Korea Institute for National Unification. About this health and medical cooperation platform, what we have to remind ourselves, I would like to touch upon these elements. As President Shin mentioned, this universal health care is so it is connected between this public sphere and the private sphere, and most of the times we are more focused on the public sphere. So I believe the direction for this platform to take in the future is the safety net of this public sphere and its interconnection to the private sphere amidst this, as if this health delivery system is being operated in an appropriate manner is what we should monitor and we should check. And the role that we can play would be in the method of private exchanges or cooperation. For instance, this free treatment and preventive treatment, what he mentioned, if according to the interviews that we had with the people on the ground, it's not operated in its full capacity. And as Mr. Shin mentioned, there were a lot of endeavors on this in North Korea in terms of modernization, and that Chairman Kim is paying a lot more attention to modernization and telemedicine. And from our institute, we are contemplating on how we can cooperate in these different domains. And our conclusion is that the acknowledgement on this knowledge cooperation or knowledge sharing with North Korea is quite low. So I believe and I hope that this platform that we are launching today will be a stepping stone and will be where we can come together to benchmark how to exchange intelligence and knowledge, and that could be tailored to the needs of the Korean Peninsula. As a speaker earlier mentioned, different types of knowledges should be accumulated in different ways on this platform, and with this, the different actors can utilize this accumulated knowledge on this platform. I hope that this could be realized on this platform. Thank you.
Thank you very much. Now, the 11th panelist is visiting Professor Lee Hae-won of the Yonsei University, please. Hello, I am the Professor Lee Hae-won from the Yonsei University. The very starting point is now here for the Health and Medical Cooperation Platform. It's a great pleasure for me to be here. I was engaged in this sector since 2010. I analyzed the data and findings and tried to identify the needs and demands, and it's been 10 years since I've been working on this. And also the current status study and also the other research on the cooperation and the policies and projects, that's what we have been doing. However, the organizations and partners working in the field in DPRK, I realized that there are limitations in terms of this whole demand-driven analysis. We need to work with the North Korea, and there are many organizations and partners, including the civic groups and international communities, and the academia and the other scholar organizations. So these organizations now dealing with the recipient of North Korea, and depending on the recipient organization of North Korea, their priorities are different. So the recipient their organizations may include their party or their council or cabinet or other like a local health institutes. So we just focus on demands and needs in terms of seeking cooperation or the policies, or if we want to just look for one single answer to this whole cooperation, it's not going to work. That's what we have learned. And as President Shin just presented, the health and medical system in North Korea, they have the resources and they have some infrastructure, and to some extent they are working. However, if it goes over to a certain level, there are the areas that will need a lot of support. For example, the traumatic or the chronic patients and chronic care, or the acute care. So for these kind of like advanced or sophisticated level of the services, they have now limitations. For example, the maternity mortality level is stagnant, and the SDG progress is still in a red light because they're not having progress in terms of the TB treatment. So these data tells us that there are limitations. In terms of the demands for the health and medical services, we need to think about more sophisticated and targeted support. However, in 2017, the sanctions have been enhanced, so it's really hard to meet the demands, and we are now having the COVID-19, and since then, this practical humanitarian aid has also stopped. And for now, there are many challenging situations, but this whole development aid have been an important part of the health and medical cooperation since the sanctions were placed. Indeed, when you look at the North Korean indicators, they have been getting better, but since 2018, they are now getting worse in terms of malnutrition or disorder and disability, and the deaths by illness are now getting worse. That's what we see from the indicators. But when you look at the local community data, we don't see those whole changes. So Seoul National University, for like 100 North Korean defectors, they checked the status or survey before they came to South Korea. It's been done for like 10 years. Of course, it's limited to the Hamgyeongbuk-do area, but when you look at the data, it shows that the price of rice or some other economic changes are not really observed from their surveys. When you look at the last year's data, it's like 1.36 million tons of food is what they need, but unofficially, what they actually need is like 10 times larger than that. So the situation in North Korea cannot be judged or decided by just looking at the official data, because things are different depending on the regions and depending on the recipient organizations or their counterparties. We see different situations that we can interact with these North Korean counterparties. So for the health and medical cooperation, our approach must be multifaceted and multidimensional, where different organizations playing different roles. And due to the COVID-19, this cooperation has stopped, and the government is now seeking to find the solutions, and North Korea can open up to like a vaccination or the response capability building efforts. We need to support them, and also to increase the quality of the medical services, we need to provide them more development cooperation, which also requires the international cooperation on multi-fronts, and this whole platform can play a role. I hope that this platform can be the basis for a more organic and mutually winning opportunity. Thank you very much.
Thank you. Next, we have panelist Mr. Peter Yoon, Administrator's Office Head at the U.S. Embassy in Korea.
Peter Yoon, I'm from the U.S. Embassy in Seoul. Thank you for inviting me to this event and giving me an opportunity to observe the effort toward cooperation on the Korean Peninsula. The United States remains committed to complete denuclearization and establishment of permanent peace on the Korean Peninsula and supports inter-Korean dialogue and engagement efforts. We are working closely with our ally, the Republic of Korea, toward that end. Of course, we still remain concerned by the Democratic People's Republic of Korea's repeated violations of multiple Security Council resolutions, and we underscore the need for both full compliance with Security Council resolutions and full implementation of all existing UN sanctions. Even when we disagree with a particular regime, however, we believe we must work to the best of our ability to do all we can to alleviate the suffering of the people. We remain deeply concerned for the welfare of the North Korean people. We continue to support international efforts aimed at the provision of critical humanitarian aid to the DPRK. As President Biden noted during the May 21 summit with President Moon, the U.S. and the Republic of Korea's partnership extends beyond the peninsula, beyond the alliance with its shared commitment to the defense of South Korea. Our partnership also addresses issues of regional and global concern, and we're looking at ways that the Republic of Korea and the United States will work together to address the challenges of our time, beginning with our efforts to end the COVID-19 pandemic globally. On September 22nd, President Biden convened a virtual global COVID-19 summit and called on the world to collectively end the COVID-19 pandemic as soon as possible, with every country, partner, and organization doing its part. President Moon joined our president at the virtual summit to reaffirm South Korea's commitment to take the lead in inclusive health cooperation. With this shared commitment to health cooperation, the United States and South Korea have resolved to work together and multilaterally to build the capacity of all countries to prevent, detect, and respond to infectious disease outbreaks. I hope that today's event can be an important step in that direction. Thank you very much.
Thank you very much. I'm happy to discuss this important topic here today with such an impressive lineup of speakers. The EU has a policy of critical engagement with the DPRK. So this combines two parts, critical and engagement. The critical part refers to pressure through sanctions and other measures to pursue our objective of bringing North Korea back to the table to achieve denuclearization in line with UN Security Council resolutions. And the engagement part of our policy focuses on the principle of keeping communications with North Korea open and also providing humanitarian support to alleviate the plight of the North Korean people. And a cornerstone of the EU approach is that lasting peace and denuclearization of the Korean Peninsula must be achieved through peaceful means. So we continue to encourage dialogue, the restart of diplomacy, and we stand ready to support any new diplomatic efforts. And we support in particular the leading role of the Republic of Korea, as well as the call of the ROK and the US on the DPRK to engage in a credible and meaningful dialogue, including on humanitarian affairs, where, of course, the health sector could be one of the most important and interesting areas to engage, as we hear from various humanitarian partners that there is a clear need in the health sector. The EU has engaged continuously in actions to address the humanitarian needs of vulnerable communities in the DPRK since 1995. Our thematic focus has been mostly on, first of all, on food security projects and also on people with disabilities and vulnerable elderly people. And the implementation of our projects is done by a number of European NGOs which have permanent residence status in the DPRK. So through them, we are not only assisting vulnerable individuals, we are also establishing eyes on the ground so that we can know what is going on, even in more remote parts of the country. We establish interaction with DPRK line ministries and local government bodies. And we have also presented a positive image of the EU and of the international community to North Korean citizens. And these projects also provide the EU with good experience on which other international partners can draw for experience on what other interventions could consist of. Of course, unfortunately, because of the DPRK's border closure following the COVID-19 pandemic, at the moment it is very difficult to know what is going on in the country, but we understand that the humanitarian situation is deteriorating. So engagement in the health sector is a key area which we should look at. And the EU projects which I mentioned, which support vulnerable elderly people and people with disabilities, have also contributed to some extent to improving public health in the DPRK. These activities which we did included providing disability care equipment to hospitals and medical centers, providing care equipment for elderly care centers, capacity building of medical staff in these areas, and awareness raising of the need for medical care for these vulnerable groups, as well as engaging at the policy level on disability and elderly care issues. And I think that our experts which have worked in these areas will be very happy to share their experience going forward. And like I mentioned, other humanitarian actors can draw on EU know-how when designing their own programs. So we look forward to discussing with our international partners other ways of cooperating in the health sector on the Korean Peninsula. And I look forward to continuing the good discussion today and later with the colleagues here. Thank you.
Thank you very much for that. Thank you for keeping your times. If we have this generous mind, I believe that this platform will be a success. So I believe I have some minutes at my hands to summarize. We are living in this COVID-19 era, and as we do so, I get to think about if this is the right way to address, because this is a pandemic in the 21st century, and the countermeasures that we're taking is that of from 19th century. We are living our lives and we're taking care of oneself, and how can we overcome such a common challenge? And amidst this challenging times, for us to surmount this successfully, we have to go back to the basics of coexistence and fairness, and this goes the same for the inter-Korean relations and cooperations. We are talking about the sustainable development of health and medical cooperation platform, and for it to be sustainable, we need a lot of people's attention and contributions. I hope that different stakeholders who are interested can come in at any times, and we can have good quality information from the government, and we know and be transparent in terms of which organization takes which roles. And including the private sector, we have a public-private partnership, and I believe that this will be a leading and best practice. This platform can be this best practice for PPP, and this should be the same that is applied to the medical cooperation platform. As we are here with a shared interests, we can be supplementary to each other, and when we do so, I believe that this cooperation platform can be sustainable. Thank you very much once again to President Shin for such a great keynote speech, and also to the 13 speakers panelists for their panel discussions. So with this, I would like to close the panel discussion. We are going to take 5 minutes break. Please take some refreshments and say hello to each other, and we will come back for our second session. Thank you.
Peninsula. Hello, I'm the moderator for the session 2 from the South North Korea Exchange and Cooperation Support Association. I am Kang Young-sik. I would like to welcome all of you to the session 2. The session 2 will be about the government and the international organizations and the private sectors, and how we can really create a sustainable health and medical cooperation platform. In session 2, same as the session 1, we will have a keynote speech, and then we will have the panel discussion. First of all, let me invite Professor Chun Woo-taek from Yonsei University on the Sustainable Health and Medical Cooperation Platform. Please welcome him with a big round of applause. It's great pleasure for me to be here. And thank you for giving me this great opportunity. The Health and Medical Cooperation Platform was created after a lot of discussion, and today we are having this inaugural meeting, and many people said that, well, there were very similar events before, so I hope that this will not be just a one-off event. So do you think it can be really sustainable? That's the question I got from the people, and I myself have the question too. So today, I'd like to share with you how we can build sustainable platform. Indeed, when we talk about platform, the term is used a lot these days. So what is it really exactly? Platform is about whether people are gathered together when they take buses or trains, but on Wikipedia or on the other like Google or the delivery apps and other services are also called as platforms where the suppliers and the consumers can meet together, where the information and the goods are traded. So after all, platform in terms of business, it's about matching the demand and supply in providing the similar services in an integrated manner so that it can provide a tangible and intangible space for those interaction. So the platform that we talk about today, in some sense, it's also similar to what I just described. So earlier I said that we had many similar events before, and these events were not really sustainable. And why is that? It was because we didn't have the clear and practical and feasible vision, purpose, and concept of how we're going to do that. So to have sustainability on the platform, what do we need to do? There are 3 ideas that I want to share with you today. I think platform, in a word, is a marketplace. So there we have a lot of people gathering together, and we can share resources and information to make meaningful outcome out of that. That is the marketplace. And in the marketplace, to have sustainability, there are 3 factors that we need to achieve. First, it's about the engagement, and people should be able to understand that if they participate, what would they get out of it? So it's about the voluntary engagement. So people can come up on themselves to the marketplace because they know that it's where they can get the information they need in a convenient and efficient manner. So at this event, I can interact with the people from the foreign embassies in Korea and NGOs and international organizations and the government ministries. We are exchanging business cards and we are networking and interacting with each other. And that is the important benefit of platform. So what should we do? I think given my experiences, to have a sustainable platform, we should create a website. So on the website, we have to allow different stakeholders upload their information and what they do, and then the other partners or stakeholders can contact them and start discussion on how they can partner. So this whole interaction can start from there on this online information sharing system, which can be on website. So then it can be one way to increase the sustainability of the platform. And also each organization should have a contact point, a focal point for contact designated. So if you want to contact a certain organization to ask questions or to get some help, it should be really clear which person you should talk to. So that's really important to have sufficient or strong platform. However, if we only get to the level, I think that's not enough. We can move to the second layer, which is that we should have the fair operation or fair principles in running the platform. So if we can get the trust and confidence from the people to play an effective role as a matchmaker, then we can be a good platform. The marketplace is important not just to gather people, but we should also think about these invisible principles, and when the people who are in the marketplace have the confidence and trust in the operating principles of the platform, then we can have bigger platform and better platform. So far, many organizations, in terms of the cooperation with the DPRK, there were like a one-to-one relation that we focused in running the project with the DPRK. That has pros and cons, and that has limitations, I think. So in terms of having the balance and the universal value and some principles of the behaviors or conduct, some were acceptable, and DPRK took it for granted, and that was how we were accustomed to in terms of interacting between North and South Korea. So sometimes North Korea just gave what we want to give to them, so with no regard to what they really need to get, and North Korea at the same time only wanted to apply their own standards, and they made some unreasonable request sometimes which may not make sense under the international standards. So I don't think the North and South Korea are not about like a boss or who has higher bargaining power, who has strong bargaining power. It's not really about that. We should start from a point where we can build a fair and the balanced model where the participants in this platform can have trust in. So in this regard, when North Korea asks us for certain help from South Korea, when we get the request at a certain organization, it was like the one-on-one cooperation approach that we have done. But now we have to build more integrated platform, and then I think we can achieve the second role of the platform that I just described. So what's really important here is that we should remember that the independence of the organizations will not go away depending on the nature of the project. Still, the organizations can have their own unique perspectives, and the expertise here is really important. And given the organizations can share their experiences of failure and success, and only then we can build a good ecosystem which is healthy and strong. And the last one is about having the platform where people can experience new values and the better outcomes. A standalone organization cannot do that, and we can achieve some new, or we can gain new values and new perspectives from this platform, which would not have been possible by one single organization. And then this platform can have a high level of sustainability. And we have to do this for two reasons. First is that we have the scale of the cooperation projects that we will conduct with North Korea will become huge and really bigger than before. So it's something that one single organization cannot handle. And the reason number two is that we have to work together to reflect upon what we have done so far in terms of the health and medical cooperation. Given its nature, the health and medical cooperation is not about the politics and not about the diplomacy, and it's for purely humanitarian purpose. But people outside our community have different perspectives. The division of Korean Peninsula and how we have to respond to the situation is a really complex issue that cannot be addressed by one single organization. So we need to work together to look into this and have more balanced perspective at each organization. And in closing, I think the cooperation in terms of health and medicine should not be about exchange of goods and supplies. It's about the value and attitude and the way of working. That's what we need to share between the two countries. And to this end, we need to think about between South and South and between the South and international organizations, reflection on our way of working and values and the attitude. So when we think about building this platform, we also need to think about building a working level group to implement our ideas. So as I mentioned before, first we have to build an online venue where different participants can share their information. In the field of the health and medical cooperation, and the platform will mean a lot, and our outcome will set a great example for the other sectors for their own platforms moving forward, setting a great role model, and that will make a great contributions to the inter-Korean relations moving forward. So in our Unification and the Health Association, we have this publication came out. In each and different health and medical sectors, we covered the approach that we need to take moving forward, and these findings and outcomes, I hope that the participants here in the platform can find it helpful. Thank you very much.
Yeah.
Thank you very much, Professor. Well, I have known him for a long time, and he has always give really succinct messages whenever he gives his presentations. And he is an expert in terms of ecology, and I believe it was very inspirational. Now let us begin our panel discussion. We are going to speak about the Sustainable Building of Health and Medical Cooperation Platform. The panelists are from 8 different areas. We have 14 panelists. Number 12 could not be here with excuse. So let me read out your names, and when your names are called, please start your panel discussion. We have about 4 minutes per panelist. Just like the first session, we are going to give an alarm after 3 minutes and 30 seconds. Whoever are online, this also applies to all of you. The first panelist is
from the Ministry of Unification, Cho Jung-hun, Director General of Humanitarian Cooperation Bureau. Good afternoon. First of all, thank you very much, Professor John, for your keynote speech on the platform, and also for the launch of our platform. Kang Young-sik, the chairman, thank you very much for playing a key role for the platform. The Health and Medical Cooperation Platform, many people have already touched up on what it is. It's a whole new way. We have never done it this way before, and it's really a new path that we take. And the core part of this platform is the openness. And in terms of the health and medical cooperation, anyone can participate. It's so open platform, and under the platform, any agenda can be freely discussed, and this is really different from our previous frameworks for cooperation. And also this whole platform, depending on how we operate, can have this huge benefit. And also some panelists mentioned that it's been driven by the government so far, but this platform will also have other benefits. Government has its own strengths, and the international organizations have their own strengths, and the private sector has its own strengths. So we want to really share these whole strengths of different participants to be shared and leverage it under the platform. And moving forward, at home and abroad, we want to involve the domestic and international parties and the government and the private sectors, and also the practical and the academic parties can be involved together. Professor Chung mentioned about 3 things: information sharing and the matchmaker role and the new values and the roles. I fully agree to your points, and in running the platform, I think these 3 points are really important thing that the Ministry of Unification also agree. And in this regard, I hope that the platform need to seek that direction, and so the Ministry of Unification will continue to work on the platform. And as was mentioned in the joint declaration, we're gonna keep the spirit, and as Professor Chon mentioned the 3 things in his keynote speech, we will share that as well. There is an old saying that if you want to go fast, you should go alone, but if you want to go further, you have to go together. We want to go faster, but I think most important thing is to go further. So with the platform for the health and medical cooperation, we will try to go further, and to do that, we can do it alone. And the platform cannot be led by one single party. So I encourage all of you to take the ownership and work together to make it a sustainable platform moving forward. And at the Ministry of Unification level, we will have a regular meeting once a year. And aside from that, depending on the agenda, we may have free discussion in different settings, different meetings, and if anything you need from our ministry, we will look into that as well. And as was mentioned in the keynote speech, the online website, the online venue, we will also look into that as well, so that we can have a platform, like hybrid platform of online and offline. And the working level group and the focal point for the contact, that will be also examined by the ministry. And it was also mentioned in the session when there are many great ideas, and all these ideas are very valuable and meaningful. So there is a lot of things that we need to do. So we will incorporate your feedback and ideas and review them when we get back to the ministry, so that we can have a really sustainable platform on the Korean Peninsula. Thank you very much.
Yeah.
Thank you very much, Mr. Jo. Next, we have Mr. Park Yong-sik from local government, Gangwon province. We have 17 local governments, and there is one that we share the same name together with North Korea, which is Gangwon province. He is from Gangwon province, and in this province government, they have a team on Peace Region Culture Division. So Mr. Park Yong-sik is here, and he's online from Chuncheon. Hello, I am Park Yong-sik, Division Head for Peace Region Culture. I congratulate the Health and Medical Cooperation Platform, and it is meaningful that I take part in this discussion of the sustainable operation of this platform. I would like to thank the Unification Ministry for this initiative. From the Gangwon province, we have already existing expertise in our provincial government in terms of many domains in cooperation with North Korea. And we are also in cooperation with Eugene Bell Foundation to support the ward to cure MDR tuberculosis. And we have pursued cooperation with North Korea on this end. However, this was stopped due to COVID-19 situation. And in 2001 and 2000, we have supported this medical supplies to North Korea and diagnostic kits. And we have done this. However, this medical supplies that we supported, it is kept at the storage point at the borderline of North Korea and China. We have also done projects, modernization projects for hospitals in Wonsan and malaria projects. And these are some of the priorities in terms of cooperation with North Korea. And we have also requested for a contest to Ministry of Unification for better support. And we have also pursued this building of establishment of a hospital. And we have played our role in terms of getting North Korea to take part in Pyeongchang Winter Olympic Games in 2018. As such, we are taking the lead in terms of inter-Korean cooperation projects. On the basis of the infrastructure that we have, we are planning to have a preemptive preparedness that should be in place for the North Korean cooperation projects. And we should have a thorough plan in terms of disease prevention measures. And connecting Najin Harbor and Sokcho, we are opening up this sea route, and also an airport connection from Gangwon province of South Korea to North Korean city. And by doing so, we need more support in terms of inter-Korean cooperation. And to this end, we are working towards making this possible and feasible together with different partners. As the joint declaration stipulates, we are amidst this health crisis, and regardless of the political situation on the peninsula, we have to guarantee the healthy lives of the people on the Korean Peninsula. All the experts and stakeholders from the NGOs and government agencies and from home and abroad and experts, I hope that we can muster our strengths to come up with a good plan to cooperate In terms of health and medical cooperation platform, Kwon province will also do our utmost to support this platform. And this community that will be formed, I hope that we can play an important role. Thank you.
Thank you very much. Thank you very much. And next, we'll move on to the international organization. Nam Sang-min from UNESCOP, the deputy head of East and Northeast Asia office is here, as you may know. The office, the VNR to the UN, it played a key role in drafting that, so I think we can expect great comments, please. Thank you very much, moderator. In preparing the VNL for North Korea about the environmental stats and the BML preparation, we had like 2 workshops in 2019, and for the Northeast Asia SDG multilateral forum, we invited the North Korean officials to share not just in South Korea, but with the other countries' experts. We had a great discussion, and in this regard, in July, North Korea published a report, and inside the South Korean society, we are seeing a very special attention that's really welcoming. So my points today, I have 3 parts. First, the health and medical cooperation needs to be engaged in or associated with these SDGs. And the second point is that, as was mentioned earlier, it's not just about the humanitarian aid, but the development cooperation or knowledge sharing should be what we need to pursue. And third, the platform that we are launching must be open, and as Professor Chun mentioned, it should be a venue for mutual coordination and information sharing. First, in terms of linking the humanitarian aid or this whole work with the SDG in the VNL, North Korea also mentioned about this lack of resources and low level of the capabilities in terms of the medicine and the health, and also the lack of the environmental impact assessment, and in terms of planning, the preventive medicine, and the building the whole system and infrastructure for the prevention of the disease. These are also mentioned in the report. So how, whether it's South Korea or the international community, how can we really help them can be what we need to think. And in terms of the environment as well, in the report, the water quality was also mentioned. With this SDG BNL report, there were 6 TF were created on the health TF. It was about the public health and the water and hygiene. So the public health was also related to the hygiene and water. That was what we discussed. And as President Shin mentioned about these bacterial diseases that in the North Korea and the waterborne disease in North Korea, and also the zoonosis in North Korea. So these are also linked to the SDGs and also the environment. So these are where we need to cooperate. And number 3, in terms of the social and economic and development and their capabilities, their technical capabilities and social economic capabilities in the public sector, we are witnessing the importance of these capabilities from the COVID-19. So there can be an opportunity for cooperation. And in terms of approach, the development cooperation, the North Korean leader Kim Jong-un has been highlighting that, and in cooperation with the other international organizations, North Korea is interested in seeking this development cooperation. So I hope that health and medical cooperation can be pursued in a creative way and whole new way, and the openness and the mutual coordination. I think in 2018, North Korea signed the Ramsar agreement, or they joined the Ramsar on the wetland, and we made a suggestion to North Korea and they accepted it. And I was involved at the working level, and I interacted with many different organizations with their own expertise, contributed, and we made it. So that can be a good experience, and I think many different parties can work together, and that's really efficient way of achieving our goal. And in the health and medical sector, I hope that can really be helpful. Thank you very much.
Thank you very much. Next, from NGO, domestic NGO. First, we have in Korea the cooperation with North Korea councils, about a dozen of them, and he's from KNCCK. Hello, I am from Korea NGO Council for Cooperation with North Korea, Lee Ju-sung. It is meaningful that we are seeing the launch of health and medical cooperation platform for the livelihoods and life on the Korean Peninsula. I would like to thank the organizers. We have 6 actors, main actors, who are here to contribute and share their knowledges and to come up with a practical methods, and I hope to see more of this in the future. The point here is sustainability. As Professor Jun mentioned, there were a lot of platforms that took place in advance to this platform, and it did not really work out. It first started out from a consensus, however, it was not sustainable. And why is this? Is because there weren't any designated organizations to take charge of it. The inter-Korean relations and cooperation with North Korea is heavily dependent on the political situation on the Korean Peninsula, and it is dependent to all the other factors other than the pure health and medical aspect, and this is the restrictions that we are facing. I'm not asking or being skeptical about the capability of the government or the public sector, but for this platform to be sustainable, we need autonomy, and we should also have an organization that is independent from all different factors. The government should play its role as one of the 6 key main actors of this platform, and I believe this is sufficient enough for the government to play its utmost role, and this should help more room for private sector to come on board. And the Northeast health community that the government is pursuing, and the other initiatives could be taken from this organization, the newly developed organization, and it could take the lead. We believe that to guarantee our safety, we need to guarantee others' safety as well. And to this end, I believe a consensus, public consensus, can be formed. And also this gives an excuse for the North Korean part to join. This is something that we cannot do on our own. We have to cooperate with North Korea as well as other actors. And as we have a stable organization, we can bring North Korea on board. Thank you.
Thank you. Moving on, we have Lee Kyung-seok, General Secretary from Green Tree International, please. Hello, good afternoon. I am from the Green Tree International, in charge of the NGOs working for the cooperation with North Korea. I'd like to talk about this platform perspective. In the era of the first industrial revolution, all the information is now shared on internet and network to create the synergy in recovering the health system in North Korea. And to respond to the COVID-19, we need to have a move beyond the short-term and individual organization level humanitarian aid. We need to build a platform and a system for information sharing, as was proposed in the keynote speech. I think it will be really effective and an opening stage for this whole cooperation. If we are connected and if we can share the information on the platform, there are a few things that we can do, and I would like to make some suggestions. First, in the field of the health and medical cooperation, we need to build the integrated database and archive where the universities and scholars and the NGOs and the government ministries can work together, because now the data is all distributed everywhere. We can meet together like this meeting, but if we build this archive on the internet and build this whole database, then it can be also accessed by the other international organizations, and they can contribute their data based on their experiences and survey or gathering from their field experiences in North Korea. So that can be a great pool of data. And also, as was suggested by the Professor Chon, the portal website for the health and medical cooperation, like the Google service, we can go in there and search anytime, anywhere, if any working level people need information. So I think that's also another great point. And to increase the participation in the platform, first, the Ministry of Unification or the other government ministries need to share the information, what's available, and also there should be some incentives to the parties that are involved. So if they share their information, there should be some support, or for the information sharing, there can be a consortium building opportunity with the other stakeholders which do not have enough information. So we need to have some guidelines on how to build this kind of the cooperation and partnership. And also on the online venue, the government can have this networking and interaction, but at the same time we need to have offline efforts so that we can update the information and share the information and stay connected. So there should be some ongoing interaction in terms of the offline interaction as well. And also in North Korea, one common challenge is that it's really hard to get the credible data or reliable data. So under the platform, in the future, there should be international organizations, or we can have some academic conferences or symposium, although we cannot share the direct data, but there should be some kind of the international platform where the North Korea can become a part of the international community. Thank you very much.
Thank you for the two gentlemen. Next, we have a major actor, the medical organizations from the Medical Association, dentists, and nurse, pharmacist, and Korean Traditional Medicine Association. Professor Yang Hye-ran sent in her video. Hello, I am director at KMA from KMA, Yang Hye-ran. The background of my proposal is based on the Moon Jae-in administration's policy toward North Korea. We had some interactions with North Korea. However, it's in a stalemate at the moment, so it's actually on hold at the moment. However, we have to look into the future in terms of making a very substantial project in terms of exchanges with North Korea, and that is why we're coming up with this project. The basic principles for our project is to prepare for an effective integration after the unification, and also make an opportunity to activate the exchanges between the two countries, and also base it on the humanitarian aid. First, I would like to propose a medical personnel, especially the doctors, a license that can be integrated. And this should be on the principles of these 5. And to this end, we can look into the proposal that we can integrate the license and certifications of the two Koreas, and based on this we can come up with a long-term plan, and we can base the expertise, base this integration on the expertise of the two Korea's doctors and also their expertise, and we should look into the license of North Korean doctors. Based on a rational process, we have to look into the actual circumstances in terms of the integrating the medical staff or personnel, and to close the gap between the capacities of the two Korea's doctors. We have to also activate more exchanges between the two sides. And when this integration comes, there could be an issue of surplus of the doctors, number of doctors. So we also have to pay more attention into this end. And next is about the exchange project between the two Koreas on the level of KMA. We are also thinking about inviting the North Korean doctors in our society meetings. And also, we can have a joint seminars, and we can also revise the 1996 publication on the North Korea, South Korea medical words. And also, we can pursue the medical appliances support project. So this could be a preparation measures, and this is a table for the cost for vaccinations on children in North Korea. And this is the cost that you're seeing to support the children in North Korea. Thank you very much.
Thank you very much, Professor Yang. Now we'll move on to the Song Ho-seo, Vice President of the Association of Korean Medicine. He's not connected online, so Vice President of the Association of Korean Medicine, please. Hello, good afternoon. I am Vice President of the Association of the Korean Medicine. I've been there for the opening ceremony, but I think it's a bit cold today, and I have like too many assignments today, and I am on the move now. So please understand. So let me share my key points. First of all, for the Sustainable Health and Medical Cooperation Platform, that is a really important thing, and we are now taking the starting point and taking the first step, so it's really meaningful. We hope that we have to develop this platform sustainable, and the Association of Korean Medicine will do our best. And so far, in terms of the Korean medicine, what we can contribute to the platform and how we can engage in the platform, I think it's about the ethnicity as a Korean. This Korean medicine is an ethnic medicine which was originated from the Korea, and also in North Korea they have this Korean medicine as well. So far we had these exchanges of people and sending out the supplies, or with the Pyongyang medical students, we had a symposium, and we also planned another event in 2019, but we couldn't do that. And also on the borderline areas, there are things that we can do. For example, cultivating some herbs, and also whether it's the Korean medicine, there are like overlapping field, whether it's about in terms of the treatment facilities or supplies, there are things that we can share with North Korea. So on this area, whether manufacturers can go in there and we can cultivate the oriental herbs there. So we have been looking into these ideas for many years. And also these are the areas that we can contribute. So moving forward, we will make continued efforts to make it happen. And also as a whole, I think the platform has very important values, and we will fully aware of them, and we will actively participate in the platform by removing the redundancy and make tangible and significant contributions. And I think after all, given the ethnicity that we are the same Korean, and the identity and having good understanding about who we are is also important. So centering on the academic symposiums for like medicine or the other treatment techniques, we can share the knowledge and information between the scholars by holding meetings or symposiums with these Korean medicine practicing doctors. I think that's what we can do as the Korean medicine community for the sustainability of the platform. We will be engaged with an open mind, and we will be proactive in developing the platform. So that concludes my comments. Thank you very much.
Yeah.
Thank you very much. I hear the police. I hope that you drive safely. It felt like he was in amidst the Amazon. Next, we have Ms. Hong Soo-yeon from Korean Dental Association. Hello. The dentistry realm, we are cooperating in the foundation or association that is already in place. Until 2014, when the Kaesong complex was shut down, until then, we were continuously working to cooperate in terms of dentistry, and we were seeing and treating patients for more than 8 years on the ground. And also, together with different groups, we have done and supported the treatment in North Korea, and we had a lot of requests from North Korea, and operating this unification group in our association in tandem with this health and medical cooperation platform launch. I hope I can propose 3 things. One is that we have a world-leading quality of dentistry in South Korea, and for this to be also enjoyed by North Korean people, we first have to have a unified terminologies in terms of dentistry with North Korea, and also we need more exchanges in our profession. Second, I would like to propose this as follows. Chairman Kim had pursued and actually requested an establishment of dentistry hospital in Pyongyang. So this is another subject apart from the level of and quality of dentistry, because we have the world's leading implant company in Korea, in South Korea. However, we believe that this should be also reached out to North Korea, and maybe it can come in a form of project. Lastly, I believe that the medical personnel are at the forefront in this cooperation aspect of health and medicine around the world. And through the health and medical cooperation on the Korean Peninsula, we believe that we can address the common challenge of climate change. Thank you.
Thank you very much, Ms. Hong, and we'll move on to the Park Myung-suk, Director of International Affairs from Korea Pharmaceutical Association. Good afternoon. I am Director of International Affairs of KPA, and for the Health and Medical Cooperation, I will talk about the medical supplies and the services that we have done so far at the KPA, and what we expect for the platform. KPA has been running the Inter-Korean projects, and it started in 2001 as a humanitarian project for the emergency relief, and it has been done individual basis as needed. So it was focused on what we really want to do and give for the DPRK people. So that was mostly led by the CSR division, but a few years ago, we started to think about what we can do together. And for the inter-Korean exchange and cooperation, work has been transferred to the International Affairs Division. And at the same time, along with the international organizations, we had the conferences on the pharmaceutical associations. We also invited North Korean officials. So based on these experiences, we learned that first, until we have a free exchange of people, we want to continue to invite them to the international symposiums to share, because that was effective in that we can understand their perspectives and we can see things from their viewpoint. We have our own perspective and we start from what we can do for them. But for example, people talked about delivering the medical supplies with helicopters, but that's not really that, because when you have earthquake or we can really deliver medical supplies to inaccessible regions, because we have these sanctions in North Korea, so that should not be practically feasible. So we need to solve that. And the second point is the whole cooperation that's needed from North Korea is not the one-way humanitarian aid. So hospitals and the modernization of their medical supplies and sharing the technologies and sharing the knowledge and the visit program to the domestic programs or countries, that's what they want. So to provide the access to these, we should think about the specific nature of the medical supplies. We have this global supply chain and it has a large scale facility. So Korea is also importing a lot of the medical supplies. So moving forward in terms of the pharmacies and the medical supplies, we have to think about the building the facilities for the medical supplies, and we can also import them back to South Korea so that this facility can play a role of Kaesong Industrial Complex. So this platform that we are having today can make it possible to turn this idea into reality. So I have high expectations. Thank you very much.
Thank you. Next, from online, we have Ms. Kang Yuni from Korean Nurse Association. She's a director. Hello, I am a director at KNA and professor at Ewha Women's University. Today, the keynote speaker mentioned that this platform for cooperation should how to operate, and his points on this was what I strongly agree on. Especially the exchanges with North Korea should not be a one-on-one exchange, but should be expanded to a broader level, where people and organizations can meet more, and the government can play a mediator's role. And from this opportunity, I would like to talk about the nurses and Korean nurses' role in this medical cooperation platform. First of all, nursing I hope that nursing can become a major pillar of this platform. Worldwide, the nursing or nurse takes up the majority of the medicine scene around the world. And however, it was not acknowledged to its fullest, and this is a point that we should ponder upon. And I hope that everyone can remember the contribution nursing plays in the intercooperation with North Korea. And in 2016, there was a symposium on the nurse aspect, and in 2017 there was a foundation to this end that was established, and it was called Unification Nursing Organization. This is the first organization for the nurse exchange between the two Koreas. And in this symposium or forum, we talked about how we can become the leading forces in terms of nurses in the medical cooperation exchanges of two Koreas. And through this forum, we talked about how we can train and educate the future nurses, and from then on, we are carrying out training sessions for the nurses who can prepare for the inter-Korean cooperations. And also, we are doing our utmost to have more understandings about the gap between the two Koreas in terms of the roles of nurses. Recently, we had an analysis on the nursing system of North Korea, and we have developed a training program for North Korean nurse. So not only the KNA, but also the Academic Society for Unification, Nurses for Unification. I hope that these platforms can serve as a leading role in this cooperation platform. Thank you.
Thank you very much. And we have 4 more to go, panelists, so we are now on time. And next panelist is Dr. Parky.
He's from Washington. I understand that it's 3:30 a.m. and I would like to ask for your understanding, and I would like to thank you for such a long time. You waited for such a long time. You can take up 5 minutes. Hello.
Enjoyed listening to Professor Deok. I'm getting an echo. Is that okay? I'm hearing myself feedback here. Okay. So I'll go. So let me first start congratulating the Ministry of Unification and the South-North Exchange and Cooperation Association for creating this platform for health cooperation with the Korean Peninsula. And I direct the North Korea program at the Korean Medical Association. And since 2007, our teams have visited Pyongyang over 20 times to work alongside North Korean doctors to support medical care of North Korean patients. We actually hosted a team of North Korean doctors in the U.S. in April of 2008. That was the last time. So cooperation among the health and medical actors in North Korea can promote sharing of information, which can be helpful in navigating the complex international regulatory landscape such as sanctions, banking channel issues, and logistics issues. And regular communication among government agencies, local governments, international organizations, NGOs, funders, and institutions can facilitate collaborative planning for increased impact and efficiency, expanded funding opportunities, and policy dialogue to support medical and health assistance in North Korea. The benefits are many, and this platform should have been created long ago. But the fact that such a platform currently does not exist leads one to wonder why this has not happened earlier. Actually, there have been attempts to create such platform back in 2017. I tried to convene a meeting at Harvard University with a list of participants very much like this event. Unfortunately, the university decided to cancel the event following the events of the Otter Warmbier case. So even then, I sensed some reluctance from the organizations in participating and sharing sensitive information in a large forum format. So we will need to be careful in balancing the benefits of coordination with the potential risk of being restricted by our counterparts in North Korea. Now, despite this word of caution, I would, however, challenge this group to use this platform to collectively voice our shared concern about the increasingly strained environment, health and medical cooperation. We should be louder in our criticism of current sanctions against North Korea. Now, although these sanctions are not intended to harm ordinary people of North Korea or hinder the delivery of aid, we all know very well that they do. Thus, recommend a creation of a work on how best to restore the humanitarian corridor for North Korea. I saw that the representatives from the US Embassy and the EU delegation were there today, and I welcome their participation because I think they're sincere when they say that they do want to make sure that humanitarian activity is maintained despite the sanctions. It would be helpful to have their presence. I believe the sanctions can be modified, though, to remove the elements that hinder health and medical cooperation with North Korea while preserving the chief aims of the sanctions. I look forward to working with the other members of this platform. Thank you.
Yeah. Thank you very much. Thank you very much. I forgot to introduce Dr. Ki-bok is a professor of the Harvard Medical School, and he's working very hard for us, the Korean community in the medical world in the U.S. And thank you very much. And we also have two other experts from the Korea Institute for National Unification. We have Mr. Kim Tae-gyun, a professor of the SNU. Please. Good afternoon. I'm not an expert in the health and medical cooperation, so my comments might not be similar to what you mentioned, but as a scholar studying the international studies, I'd like to make two proposals. Well, this platform, to make it sustainable, I think the coordination is really important, and that is a must. So far, in terms of the aid to North Korea, there are two dilemmas. Well, the coordination has not been there so far. So the first coordination is with the DPRK, and we have failed, or we have been blamed for doling out the aids because we don't have any idea about how our supports are being used in North Korea. That was the one-on-one interaction that Professor Chon mentioned. And we also need the other coordination between donors. There are different donors, government, NGOs, and international organizations, and also the supporting bodies for the DPRK. So the starting point should be made on the platform, and without having these incentives, we will just end up having the information sharing, and then platform will not be sustainable. So although we may not be able to plan everything from the outset, but when you have the enough level of the trust and confidence in the platform, maybe on an annual or other regular basis, we have to share the ideas, and all the principles contained in the Paris Agreement can be addressed in the platform. And the key factor is the harmonization So not just the recipients, but with the donors, we have to have harmonization. African countries dealing with like over 20 agencies for aid, so it means that they have like a one-on-one interaction, but if things don't work out, they move to the next one, so it's like a 1 to 20. So to prevent that, whether it takes like 10 years or 2 years, every 2 years or every 10 years, we have to gather together and to share their plans about what they're gonna do. Then we can remove the redundancy and we can work together for the common goal. And this information is what we need to share, and that will be about the coordination, and we can address this dilemma of coordination. And the second point, or my proposal for the second point is that when you have as one of the incentives program, well, it may not make sense, but VNL for the SDG on the Korean Peninsula, we can prepare one VNL report as one Korea. North Korea submitted its own report in June, but even though the North Korea can't attend, but maybe through this platform, different counterparties can take part in. So by 2030, the medical and health sector, what we need to do, and we can submit the paper to the UN. So it's kind of an alternative paper. When I went to UN last year, I asked the question. We are now researching on the Korean Peninsula SDG, and their answer was that it doesn't really necessarily one country submitting one report. So if they agree, they can have a common and joint VNL together. So the Central Asian countries are now working together to submit one VNL report. So not just for the entire SDG, but specifically for the health and medical sector, we can submit the one VNL to the UN as one incentive, or that can be one shared goal. I think that can be a really important thing to make our platform a very powerful thing. Thank you very much.
Thank you very much. That was very meaningful about the cooperation and a discussion point as an SDG and a common VNR report. I hope that will happen very soon, and when that happens, you will take part. Next, we have Professor Park Sang-min from SNU. I am very delighted to take part in this meaningful event. About 1.5 months ago, Asia Pacific Leadership Network was a platform where we discussed about the nuclear threats from North Korea and how we can cooperate to minimize the threats. And CTR Plus was one of the agenda that we talked about, and this was about the energy and medical, health and medical agenda that was included here, and why medical was incorporated was because the safety of security of the Korean Peninsula is closely related to the health and medical situation. For this platform to survive, we need, in addition to the annual meeting, we should collect the discussions, the different discussions that took place, and we have to decide on which should go official and not. And we shall publish a report that can feed into a real policy or strategy making. From that forum, what I felt was that not only the security and North Korean nuclear threats, we also have to think about other aspects such as health and medical aspect. And this goes for this platform as well, and we have to take into account R&D aspect as well. And as Professor John proposed, we for different stakeholders to take part, we need a bigger agenda that could be shared by different stakeholders. This could be shared and be discussed, and amongst that, this was one of the agenda that I would like to propose. I believe the Ministry of Unification had already worked on this. The two Koreas at the borderline of the two Koreas, biomedical cluster, forming a biomedical cluster was one of the blueprints that the Unification Ministry had worked on, and this has an R&D aspect and a clinical aspect of that incorporates the dentistry and Korean medicine and also veterinary clinic. And with that pillar in mind, it could be linked to industrialization like vaccine projects or agricultural projects, as well as pharmaceutical projects. So this could be the Korean Peninsula biomedical cluster that could come into play to be in between the two Koreas and can be a bridge between the two Koreas in this sector. And how can we implement this, and what is the limitations, and what should be a prerequisite in terms of resolving the issues for this to happen, and what is the role of the central government? So this is the proposal that I would like to make today. And aside from this, there would be a very big agenda, other agendas that should come into this picture. And as we accumulate more substantial and tangible agenda as such, I believe North Korea could take notice, and it could be in earnest a platform where the synergy can be created by different stakeholders. Thank you very much.
Thank you very much. And we had like a 14 panelists, and we have one more panelist from the British Embassy. So we have Mr. David Snower, Consular, is here with us, please.
Great, thank you very much, and thank you for giving me the last opportunity of the day to express our support for this great initiative. As has been made clear to all of us over the past couple of years, health issues are not always geographically isolated inside national borders, but require international cooperation, particularly among neighboring countries. I acknowledge that there are particular challenges to cooperation on the Korean Peninsula, and so we particularly welcome new initiatives like this that try to facilitate just that. The United Kingdom is concerned that humanitarian needs in North Korea may well be growing. We think it's important to get humanitarian workers back on the ground in order to give us a fuller understanding of the situation there and in order to facilitate the flow of aid back into the country. Ultimately, we believe that denuclearization is the way to create a more stable, prosperous, and healthy future for North Korea and its people. And we're committed to upholding international sanctions to help achieve this goal. Professor Park expressed concern about the impact of sanctions on the delivery of humanitarian aid. I want to emphasize that sanctions are not targeted at the North Korean people. We fully support the delivery of humanitarian support to the most vulnerable in North Korean society and want to ensure that the sanctions regime does not prevent this. Areas like health and medical cooperation should be the least controversial and most obviously of mutual benefit. All countries have had to cooperate with one another in order to limit the impact of the COVID-19 pandemic and to ensure the distribution and delivery of vaccines. The UK is committed to ensuring rapid and equitable global access to safe and effective COVID-19 vaccines. Over the next 5 years, my government has already pledged over £2 billion, which I believe is over 3 trillion won, to Gavi. And through Gavi, we have encouraged DPRK to sign up to COVAX's advanced market commitment. We're pleased that DPRK has applied for support through the COVAX programme, and we hope that it will accept the offer of several million vaccine doses already allocated to it by COVAX. The special attention that will be given tomorrow at this platform's sectoral meetings to Korean Peninsula cooperation in response to COVID-19 in particular, and establishing infectious disease response systems in general is extremely relevant and pressing, alongside the more perennial issues of health, nutrition, and disaster response. So we wish this platform every success in facilitating cooperation on the Korean Peninsula, improving health outcomes for its inhabitants, and deepening the mutual trust necessary for the wider strengthening of peace and stability. Thank you.
Thank you very much. Well, we have some time. And I was wondering what snore means, your family name means. Maybe is it that you make the snow to fall? So I hope that the snow of peace could fall on the Korean Peninsula. When we talk about platform, the most important point will be the thing to be on time. So we are actually really right on time. We started at 2 o'clock sharp, and we are finishing at 6 p.m., but maybe we can arrive a little bit earlier. So let me wrap up today's meeting. In particular, I would like, it would have been great if we could hear more opinions, people who are attending online. However, we couldn't, so this is a pity. This Health and Medical Cooperation Platform on the Korean Peninsula inaugural meeting comes to an end. I would like to thank all the people online and offline for taking your time to attend this meeting. As aforementioned, the COVID-19 pandemic and the humanitarian crisis that we are facing, we should overcome these challenges by humanitarian cooperation. We have learned, it was palpable how we are interconnected amidst this pandemic. So COVID-19 or these diseases and cooperation to this front is not only about my survival, but the survival of others as well. So we have made a consensus that we need cooperation in terms of North Korean support, and especially two Koreas are sharing a lot of things in common. And we are also a health community. We only not share the geography, but also the lives are intertwined. And to cooperate on this front with North Korea is not only for North Korea, but also it's the survival of the South Korean people as well. And the humanitarian crisis that is exacerbating in North Korea is one of the big concerning points from our point of view. I hope that this platform on the Korean Peninsula, it could start or restart the humanitarian aid to North Korea. The inter-Korean relations are at a stalemate, and we are facing a lot of challenges, and we don't have that much time. We're running out of time. So we have to come up with resolutions based on dialogues with North Korea. To this end, South and North Korea and the international cooperation on the health and medical front should continue, and I hope that this inaugural meeting would serve as a momentum to begin this cooperation. There's a saying that as the reality is harsh, we can muster our strengths to resolve even more and muster our strengths even more. And I hope that this COVID-19 crisis can serve as an opportunity to overcome this inter-Korean challenges, and I hope that we can turn that into an opportunity. And this platform on the Korean Peninsula on the health and medical cooperation is a regular consultative body where people can come together in terms of health and medical cooperation. And not today, but in the future, I hope that we have medical and health staff or executives from North Korea to take part in this meeting. I believe and I hope that this was a fruitful discussion for all of you who took part. As we have promised in the joint declaration, we are going to strengthen the communications and to do our utmost, especially the Ministry of Unification and also the KNCCK. We are going to do our utmost for this to live and survive and prosper. I wish to ask you for your avid support in the future. In particular, I would like to thank the organizers and the interpreters. Thank you very much. I hope to see you soon. Thank you.